Hello, all. Thank you for kicking off our 10th anniversary of Medicinal Mindfulness. My name is Stacy Stickler. I am the project manager for Medicinal Mindfulness and the director of the new Medicinal Mindfulness Foundation. I'm excited that you're viewing this video because we have a lot to talk about. So let's get started by introducing our clinical team. Alison?
Stacy, hi everyone. I'm Alison McQueen. I'm the clinical director and co-founder of the Center for Medicinal Mindfulness. I'm a licensed professional counselor, psychedelic therapist, of course, and was a MAPS MDMA assisted psychotherapist in the phase 2 trials a few years back. So really have spent the last decade integrating psychedelics and psychotherapy. I love talking about this work, so I'm really glad to have this opportunity to share it today.
Great.
And my name is Jahmaya Kessler, and I have a master's in counseling psychology, and I'm a licensed professional counselor and a psychedelic therapist on our team. And my specialties are in somatic work and in the psychedelic work and in bringing embodiment to and discharge of trauma. That's where I see this work being really useful. And I love talking about it because I feel like I get to see the things that we read in books happen much quicker, much easier. And it's really rewarding to see it all the time.
And my name is Alyse Power. I'm a family medicine physician and the medical director at the Center for Medicinal Mindfulness. Just like Alison and Jahmaya said, I am also really excited to talk about this work. It's an honor to be a part of this work and glad to be sharing that all with you today.
Wonderful. Thank you all very much. Let's jump right in. We have a lot to talk about and a lot to share with everyone. So first question, the title of this conversation is Psychedelic Therapy is Already Legal. So when I hear the term psychedelic therapy, it's often used in the future tense when psychedelic therapy is legal. So you're telling us that it's already legal. Can you tell us more about that?
Yeah, it is legal. It's happening now. We have a 6-office psychedelic therapy clinic on this side, a couple more offices on the other side, as well as a group psychedelic therapy space. Actually, Alyse is in the group space now, so you're seeing that. We're working with legal medicines and legal medicines only, which in the state of Colorado means cannabis assisted and ketamine assisted psychedelic therapy, all with medical oversight, all with professional guidance from therapists and psychedelic guides throughout the entire process. Of course, there are extensive safety protocols in place, and it's not just psychedelics, right? It's preparation and then guided psychedelic sessions as well as integration on the other side of it. Anything anyone else wants to add about the fact that it is already legal?
I think that a lot of people, when they think about psychedelic therapy, are often thinking about what have been termed the more traditional psychedelics, such as LSD and psilocybin, which are not yet legal. But I think a lot of people also come to us and say, well, I've been utilizing cannabis for years and I've never had any psychedelic benefit from it. I've never had a psychedelic experience. And the thing is that the way that we teach them to create their blends and the way that we work with the medicine with them having a trained psychedelic guide or therapist, and just the environment created at our clinic with the music and the whole experience, all of that comes together to create a psychedelic experience with this medicine. And then with ketamine, ketamine has been around since the 60s. We've been using it legally and safely. And one of the ways that we use it is I used to work in the ER, We use it for what's called procedural sedation. So if you come in and you've dislocated your shoulder and we need to put it back into place, you obviously don't want to be feeling that. And so ketamine is a dissociative anesthetic, meaning that you often don't feel connected to your body, especially at these higher doses that we're giving in the ER. But it has the added benefit of having a really low side effect profile, meaning that it doesn't have a lot of side effects, unlike most other anesthetics, which can cause a lot of side effects that we have to monitor. So ketamine has been around for decades and has been shown to be a very safe medicine that we still use in the ER, in the OR today. And we have found that it also has the potential as a psychedelic medicine.
Well, and what's happening with ketamine, it's a dissociative anesthetic, right? So, but when I say dissociative in this sense, I mean the good kind of dissociation where you have an opportunity to step out of your ordinary mind, your ordinary patterning and ways of perceiving things, right? It's that the out of body, kind of getting a bird's eye view on your life and your situation, right? And that's a game changer in terms of mental health, in terms of interrupting patterns, circularity, addiction. It can really step in and alter someone's consciousness temporarily, but in a way that impacts them permanently.
Yeah, and my kind of working definition of psychedelic is medicines that expand consciousness, allow us to see things from other angles, possibly have us have visions or receive insights from different angles, out of the box kind of understandings or dissolution of the ego. And yeah, both of these are really effective for doing these things, really powerful at it.
Well, they work so differently than each other, right? What ketamine does is amazing. I would say cannabis is as psychedelic, it's as evocative as ketamine in this space, but works very differently because it's the somatic psychedelic, right? It's amplifying body awareness. So imagine being able to turn up the volume on all of the inner sensations, right? And with that comes memories, stories, emotions, traumas, all our greatest gifts, right? It's all held in the body, but in an ordinary state of consciousness, we can't necessarily access that, right? With the support of psychedelic cannabis, which, as Alyse mentioned, it's not just any cannabis you can get, it's a specific blend, specific ratio that we're working with that really provides that psychedelic experience.
Yeah, and a core staple of all psychedelic work over the last 60, 70 years has been set and setting. So using these things in a precise way, with proper dosage and right intent, we get the results that we're trying to achieve. It's different than just recreationally imbibing something. It's quite different when you take a high dose and you put on a blindfold and a therapist or a minister is holding space for something to happen. And it always does.
So I'm glad that you brought set and setting back up, Jahmaya. Tell me a little bit about where you all are in the medicinal mindfulness offices and what you do there, how you set up that sacred space for your client.
Yeah, sure. Well, I'm in my office right now. My office is set up. I just had a 60-minute prep session for someone who's about to do a psychedelic therapy protocol. So right now it's just set up for, client there, me there. When I'm doing medicine work, the couch pulls out into a bed, and then, behind me, I'm an art therapist. That's what my master's degree is in. So I've got a whole art studio set up, a lot of materials out, primarily to be able to do art-based psychedelic integration, which is one of my favorite things ever. So.
Yeah, I'm in the office I use most often over here. And yeah, there's a nature theme here, which I just find is really grounding. And we have singing bowls in the back. And this is kind of a traditional setup here. Got our bed and eye mask, and yeah, it's soundproofed, and lots of big experiences can happen in these spaces. And yeah, we've kind of set the tone that that's just okay to happen in this office. So this is like a space for big experiences to happen.
And they do.
So I get to feel there's a lot of really good energy coming out of that room.
Oh yeah, it is palpable for sure. And I am in the group space where we actually had a 7-person ketamine assisted psychotherapy session the other day, which was really amazing. And so as you can see, we have the mats set up here, and we can even put, like I said, we just had a 7-person session, so we can put more mats in here. The little, there we go. The little red chairs are for our sitters or our guides, so that they can be close to the people having the experience.
Yeah, and I do want to mention that we did just have a group ketamine experience in that room just this week. And that was really beautiful. And I want to mention that I am in Reverend Kristen Saki's office, and it's set up because she just had a 2-day cannabis intensive. And she is one of 2 interfaith ordained ministers that we have on staff. Speaking of protocols, we're talking about cannabis, we're talking about ketamine. How can you talk a little bit more about what that looks like when if a client calls in for a consultation or comes in and talks to you all?
Oftentimes clients are just intuitively drawn to either cannabis or ketamine. Sometimes that's what happens, or for various reasons, we'll make a recommendation for one over the other. But most clients over time are interested in working with both medicines, of course, on different days. But, we can combine a protocol. So, for example, a week-long psychedelic therapy intensive would allow a client to have 2 5-hour cannabis sessions as well as 2 3-hour ketamine sessions, plus integration in the middle that allows you really get the best of both medicines in a short period of time. The out-of-body dissociative anesthetic of ketamine, the deep nervous system reset of ketamine, and then the somatic soul work, depth work, trauma resolution work that cannabis does really well. You can pair them in a short protocol very easily.
Okay, so I'm very curious to hear, what are you seeing in your clients in response to these treatments?
So many things. We see people have such big and beautiful, powerful, transformative experiences. We see people coming in and experiencing the benefit of having something, like shedding that which is no longer serving you, which can manifest in so many different ways, but then seeing them lighter after having shed that part of them, and sometimes there's joy, sometimes there's sadness, sometimes it's difficult, sometimes there's laughter, and it's all of these different things. It's a really a beautiful thing.
Yeah, I could add to that. I've been in private practice for over 10 years now. And I guess what I noticed the most is how much more efficient some of the work we can do is. It's like, I've been working and doing somatic trauma work for a long time. And yet that can take a long time to get to those vulnerable places, to get to these big discharges and kind of release, and where people, really see the fruits of that. I mean, you see people, it's not to knock like that slow movement, because actually that's really important. I think in conjunction with any work like this, it's not all just supposed to be fast, but I do find it extraordinarily rewarding to see fruits happen at what feels like a much faster pace. So having experiences of clients like, getting to these elusive places where, we get a lot of clients who've tried everything else. That seems like a really common client is, I've tried everything. This is my last ditch effort to have something happen or some change happen. And I feel really rewarded to get to say that we get to see that. Like we see people have these like these grieving moments where they're finding all the stuff that is just always been right there, but hard to get to. So yeah, some experiences of just seeing clients like cry for the first time in maybe many years. Or yeah, I have a client recently who yeah, it's just like made these little adjustments. They're also working with our nutritionist, and just it's like they look so much lighter. They're like happier with their family. It plugs right in to just their life being easier. And that honestly is so much food to just keep doing this.
Mhm. Yeah, a lot of people call psychedelic therapy 20 years of therapy in a day because of the accelerated rate at which this occurs. Because I mean, the psychedelic medicines and just the psychedelic space act as a catalyst, you know, and when you're able to use these medicines to induce a non-ordinary state of consciousness, you no longer have like what we usually have when we go into traditional talk therapy, where you have your defenses erected, whether you're consciously aware of that or not. You know, psychedelics help to kind of pull those down so that you can get into this state of psychologic vulnerability, which is just the therapeutic potential there is just so significant, you know, and we can really capitalize on that moment with these medicines.
I really enjoy working with parents in this space. I have a lot of clients who are parents, and you know what I see again and again is if they're willing, which first if they're here, they want change, they want transformation, right? They want to expand their awareness in terms of conscious parenting. And what I see is that, you know, cannabis in particular can help them feel core patterning that's held in the body, right? So imagine working with someone who feels a particular tension on one side, or an ache in their belly, wherever it is. With the support of the medicine, you can travel inside of those sensations and unpack what's there. And in that sort of state of consciousness, people can become aware of, oh, right, that thing I'm holding, it came from mom, or it came from her mom. We can trace it all the way back, right, to the beginning of a pattern. And then from that place, they have the ability to shift it with their own children. And that's an extraordinary thing to see. Parents who break cycles, right? Again and again, right in this room, people are breaking intergenerational patterns and making life very different for their children than what they experience. I find that just incredibly heartwarming and inspiring.
Beautiful. So I know that there are other ketamine clinics and services out there. And there are other people who are offering psychedelic therapy, whether it be legal or not. So what makes medicinal mindfulness different?
So one of the things that's different about a lot of the ketamine clinics is that they're utilizing IV ketamine as a continuous infusion, whereas we're using either intramuscular ketamine or ketamine in a lozenge form. And one of the reasons that these clinics are using IV ketamine, or there's two reasons. One of the reasons is because the initial studies surrounding the effectiveness of ketamine and that those studies were conducted with IV ketamine. And the reason behind that is not because the IV ketamine is more effective, but because it made it easier for them to, do like lab draws and that kind of thing in that setting, and to really measure the effect of the ketamine and the levels of the ketamine in the blood. And the second reason for that is because at a lot of these ketamine IV infusion places, it is usually somebody like a nurse, or maybe it might be another type of provider who sits you down and puts them. Don't have a psychedelic guide or therapist there with you. And so that's very different from what we're doing. And so because you're not with a trained psychedelic guide, you know, if you have a big experience, and which can be really vital to your healing, you know, to get through that experience. But in these settings, if you have these big experiences, sometimes they get kind of nervous, and so they turn off the medicine, not wanting you to have a so-called bad experience. But if we can kind of reframe that and think of it as not necessarily a bad experience, but perhaps a difficult one, but one that might be paramount to your healing. And that's what we do here, is that we encourage you to get through those experiences with our help. We want you to get through that, because it come through to the other side, you have an opportunity to have learned something and to have really gained something as far as your healing journey goes.
Yeah, and just a little practical, that was beautiful, Alyse. Just, like that extra time really matters. The extra gentle entry, the intention setting, the trained professional. I think you hit on this really well, but yeah, just to highlight that feels really the most stark to me as a clinician is just, I can't imagine just having somebody sort of show up, plug in, and get popped out in 2 hours, as opposed to having preparatory sessions, really like eliciting what it is that you want, that you might expect to find, or having somebody be acquainted with what's there, and then to have even like a larger space to have that experience. The encouragement and allowance for it to be a big experience, which a lot of ketamine clinics don't necessarily allow for, right? There's not, it's going to get shut down if it's too big. It could be in a group with other people. It's like, so yeah, having space and having trained people who are used to having big energy come up, I think makes a huge difference. And then, the aftercare, like the slow, even just the right afterwards, having an extra hour, and then integration, and that container being there for this ongoing work. It's not just take something and something gets fixed. It's all that other stuff in between. Like the journey starts in the preparation and it ends long after, actually. So having that thread, that feels like how the healing happens. It's not just the ketamine.
Right.
Yeah, and I'll say that, Alison, I've heard you say this before, and I don't know about the others. If all the other psychedelic medicines were legal, you would choose cannabis to work with. Can you say a little bit more about why cannabis is so powerful?
Yeah, and it's nothing against the other psychedelics. Like I would absolutely love to be offering psilocybin, MDMA, which we will when we can, right? I've seen through the clinical trials the benefits of MDMA-assisted psychotherapy. It's fantastic, right? But if all of them were legal, cannabis and ketamine would still be among my favorites. I think cannabis in particular for doing trauma work, I'm a trauma specialist, right? So this is really my niche within this work. I think, if you think of trauma as something that happens unto you, something you didn't choose, right? In a cannabis experience, you are in charge. You're the one driving the car, right? You have agency the whole time. And that's a big deal, right? With most psychedelics, it's like you're getting strapped into the roller coaster and zoom, off you go. With cannabis, you can steer, right? If you want to turn towards ancestral healing, you can. If you want to turn towards a particular single event trauma, long-term developmental trauma, you can. So I think people having that agency and having choice in their healing process is really empowering, and cannabis provides that really beautifully.
Yeah, great.
I would second all of that. I just want to add that another reason why I would choose these over other things, like one, what Alison said is just, they are just extraordinarily powerful. But what I've learned is that it's actually really nice to have like the duration in which these are, it's like the shorter duration, the same potency, but it doesn't have to be 8 hours or a whole day, or there's not this really extra long recovery. And it feels more precise in that way, and it can be done, it can fit into people's lives in a much easier way. So there's just, it's more affordable. It just has a lot of practicalities along with being just as powerful tools.
Well, and with cannabis, for example, you can do back-to-back sessions, 2 days in a row. You can go really deep. With some other medicines, you're having to space them out multiple weeks or a month apart.
Mhm.
I like that format. And just in terms of practically for clients, but also for therapists, for me, I love that my client time, it fits into the school day, right? I drop the kids off, do this deep dive, amazing soul journey with someone, and then pick the kids up by 3. I love that. So less burnout for therapists, I think, with that model, which I think is important for the movement overall.
I'm in the same boat. It's like I have 3 kids and I got to fit this into my day job. So 8-hour sessions, just it's not really, wouldn't work out so well. It'd be a lot less work happening. And I think we kind of said this earlier, but I feel like I want to add to it that there is something especially beautiful about cannabis and ketamine in conjunction.
Mhm.
They seem to be really amazing allies, and I think there was words put to this, but my own would be that ketamine is this powerful kind of dissociative. It sweeps things away. It resets. It's a very powerful, I call it the reset often. It's just a reboot. And cannabis elicits a lot, so it can really stir things up, and it can get things to the surface and feel it more. Ketamine's it allows people to even do the work sometimes because they might be so triggered that it's hard to get into spaces like this. And then cannabis allows for people to feel it more. So in conjunction, it's like they're really 2 very powerful tools that aid each other. Sometimes ketamine can help people get into this work. Sometimes ketamine actually is a really nice way to sweep it out at the end. Or there's a lot of different protocols that have different usage and different benefits. But just together they do really amazing things. So I've been really loving what happens week long.
Yeah. Well, and I think with ketamine, because it's a dissociative anesthetic, and I think Alison talked about earlier about having the opportunity to have a bird's eye perspective on whatever it is you're bringing in as your intention, and then you have cannabis, which is such a somatic medicine, and so you have ketamine that's basically allowing you to look at your intention through the lens of potentially not having your body participate in that moment. And sometimes that can be helpful to have that disassociation, and to allow your consciousness to participate only. And then to come in with the cannabis and have this super somatic experience. And something that I talk to clients about, is that with the cannabis and the somatic experience, a lot of times that means taking your intention or perhaps your trauma and having the ability to see that trauma manifest in a physical, tangible way, which oftentimes makes it easier to deal with. And one of the examples that I give is, for example, somebody came in and they were having foot pain, and during their journey with cannabis, they experienced that foot pain as being little mice and dust mites in their foot that they were then able to take a broom and sweep it out. And so, you can have that opportunity again to create this tangibility, which can make it so much easier to work with. And so when you have ketamine and cannabis together, we talk about a 360 view, but I feel that's just circumferential and not really enough. So I feel you have these 2 perspectives together that come together to give you this really spherical view of whatever you're bringing in as your intention, a really complete look at what you're bringing in. And it's a really powerful thing.
Yeah, I love that you're talking about intention so much, Alyse. I have been fortunate enough to work with both ketamine and cannabis in my work here and my training through Medicinal Mindfulness. And what I really love about our work is the time for intention, right? The prep that goes into that, and the deep dive into what are we really looking for from these sessions and from this medicine. And then in the session itself, there is ceremony and ritual, and what works for me might not work for others. And I know that our practitioners take so much care to talk to their clients about what to bring in and what to leave out of the room, right? To make it ceremonial and a ritual. And I just think that's so beautiful, and I love that so much. So I ask you, what do you love about this work?
everything. I love everything about this work. I don't think I ever want to stop doing it. It's such an honor to be a part of. And, you know, as being trained and continuing to work as a traditional allopathic physician, this is just such a different side of caring for people, in such a different way. And I don't know if there's anything in Western medicine that I believe in the same way as I believe in this, you know, like, and I think that that's one of the things that makes this so powerful for not only us, of course, because it's not about us, but for our clients, is how much we all really love and believe in what we're doing here. Because it's just easy for me to want to share this medicine with people. It's easy for me to want to talk to people about it. It's easy for me to recommend it to clients and to provide them hope, because I really have seen how effective this medicine can be. And I've experienced that firsthand. You know, it's not, it's just not a hard thing to promote. You know, it just is effortless.
Yeah, I really feel like my own joy is reflected in what you just said there. Just yeah, I think you hit on a lot of great places that I resonate with. I love it because it feels really fruitful. It feels like, you know, I kind of got this from what you just said there, Alyse. It's like, or I had this image of you like getting into allopathic medicine to help people, you know, and it's like, this feels like really helping people. It's like
Absolutely
really healing.
Mm-hmm.
And I think that's what I love about it the most, is feeling like I became a counselor because I wanted to see people get better. I wanted to see people heal. And I get to see that often. It's so tangible. It's so palatable, palpable, that people are making real impactful change, and you see the fruits. So that's what I love. I think I could never stop doing it. I'd be bored. Like I said, I love the slow stuff. I love talk therapy. I love, you know, what happened. Like, you can do a lot in that space, and in conjunction with this, I just think, yeah, what we do is completely awesome.
You know, I feel the same. I'm madly in love with this work. It feeds me on a soul level. It inspires me. It causes me to grow more as a person. All the time, I'm learning from my clients and from the process. I also just love the spectrum of someone comes in with post-traumatic stress disorder or post-traumatic stress of some kind, and you know, we address that. What happened? How is it living in you? How can we update the nervous system so that it doesn't feel like it's currently happening anymore? That all happens early on, right? And then we move into post-traumatic growth. And I love that shift when people start talking about the present and the future instead of only talking about the past, which is indicative of them feeling better, right? And the conversation shift out of what happened that hurt, and it's more, who are you? Who are you really? What do you want for your life? And really exploring what's possible now that wasn't possible before. I find that incredibly exciting and inspiring to see people just light up from the inside and then create a life that's in integrity for them, a life that they choose themselves.
I heard that language from everybody. You know, it's like that lightness, that that like brightness. It's like you see people walk out lighter. It's just, damn, does that feel good? Different smile, different way that they laugh. It's like,
yeah. The other day when Kristen's client was leaving, I almost didn't recognize her. She looked 20 years younger. It was amazing.
Oh, lots of magic, lots of healing. So before I wrap this up and talk about some next steps, ways to get involved for the people who are watching, is there anything else that you all want to tell people who are watching? Anything we maybe didn't cover?
Well, one thing I didn't cover is just how much I truly value and trust all of the people that I work with here. We have a really excellent team of people. And so again, like when I do medical evals for our clients, it is very, very easy for me to recommend and support whatever guide they're working with. And it also, like, because these people are so amazing, like that just makes their belief in the work that much more powerful. And again, just easy to recommend. So I really value you all.
Well said. One thing I'd like to add is, obviously this conversation is with licensed professional counselors and a medical doctor. I want to name, I don't think that psychedelic therapy belongs only in the hands of licensed therapists. I think psychotherapists are fantastic and have a place in this movement, but I think really medicine work is as old as time, right? Psychotherapy is a relatively new, modern idea, right? So I think it's really important that this work be accessible, and you'll see on our clinical team, right? We have therapists as well as ordained interfaith ministers, pre-licensed therapists. I think there's a lot of different professional orientations and backgrounds that can, people from those orientations can step into this work and be incredibly skillful psychedelic guides.
Absolutely.
You're here. Like, they hold amazing space.
Mm-hmm.
They bring a whole different flavor of juice, and it's yeah.
All right. Well, I want to thank each of you for your time. Thank you so much. I can feel the love beaming from the screen. That's amazing. I do want to talk about, so what's next for the people watching? How can you get involved? So if you're interested just in your own general healing or have more questions for our clinical staff, then you can reach out through our website. Our contact us page will get you right to being set up for a consultation. And if you're curious about how to use cannabis as a psychedelic medicine, then we have what we call the Psychedelic Sitter School. So we have 3 different level trainings right now, and we're working on more. There just happens to be a level 1 training that starts in May, and we're still accepting applicants. So you can check out our Psychedelic Sitter School website for more information about that. We would love to have you. Even if you're not a mental health professional, like Alison said, it's open to all. We have a community track for those who are just interested to get to know the medicine more, or there is a professional track, including credentialing, so that we can build a good network and accountable professional network out there. And as I said, I'm the director of the new nonprofit of Medicinal Mindfulness, the foundation. And our priorities include education and outreach about cannabis as a psychedelic, because again, we're having this conversation because people say, what, cannabis is a psychedelic? Yeah, and so to help with that education for both the general public and the clinician world, we have organized nearly 25 academics, scientists, researchers, and mental health practitioners for a research consortium where we are working on getting research done on cannabis as a psychedelic so we can have a stronger foundation to do more of that education and outreach. So that's incredibly exciting. It is international, so very powerful reach there. And another thing that our nonprofit is really committed to is the safety and ethics of the psychedelic world. That's really important to us. You can find more about our safety community guidelines on our website. But that we take that really seriously. And as a space that is just kind of getting started professionally out there, right? It's something to really pay attention to. So we commit and recommit, and we're always evolving and always growing. So this week, this is the first kickoff of our 10-year anniversary of doing this work. There are a week of free online events for you all to check out. And if you are interested in supporting our work, with the nonprofit, then you can check out again on our website. Under the About Us, there's a nonprofit program page, so you can check that out. We're just really excited about this week's event and really can't wait to celebrate with you all. Thank you so much.
Join us, everyone. It's going to be fun.
Absolutely. Thank you, guys.
Thank you.